New this morning on the Capitol Watch for you, supporters of Senate Bill 1034 say they are looking for answers after their bill is being held in committee after passing the full Senate a few weeks ago. And that bill is aimed at making sure that oral and IV chemotherapy is priced fairly under the state health insurance plans. Now, critics of the legislation, however, say that it's a narrow bill that has flaws.
They're not making it where you can't get it, but they've made it so extremely expensive that it's the same thing.
Medication used to help treat cancer is so expensive that some people simply have to skip treatment.
I've been through chemotherapy, oral, intravenous. I've been to the doctor where they've prescribed me a medication. I've made it to the pharmacy, and then I find out how much the medication is, and I walk away without it. It's sitting on the counter, and I could reach out and touch it, but I can't take it home with me.
Chris Bruce is a leukemia survivor who now works as an advocate, working to help cancer patients get the care they need. This legislative session, he is focused on Senate Bill 1034. The proposed legislation looks to ensure equal cost sharing for orally administered anti-cancer treatments and traditional intravenous treatments on state health insurance plans. Supporters of the bill explain one of the big issues is that oral medications are covered under pharmacy benefits and IV chemo is under medical.
If you have intravenous chemotherapy, you go to the doctor and get it, you can make payments on it. But if you have an oral medication, when you get to the pharmacy, you have to pay that entire deductible right there.
The bill passed through the Senate and is now awaiting a hearing in the House Health and Welfare Committee. Bill sponsor, Representative John Vander Woude, has been working on the legislation for a number of years. He hopes it can make a difference for cancer patients in need.
But I think it sends a message to the insurance companies as, hey, you know, you got to start looking at what you treat as pharmaceutical and what you treat as medical.
It's been over a week since the bill passed through the Senate, but it's yet to have a hearing. House Health and Welfare Committee Chairman Fred Wood says he thinks the bill is flawed.
The classification of the drug or the drugs du jour are oral chemotherapy. But what we're really talking about and the real issue before America, and not only Idaho but America today, is the high cost of drugs. The problem is that this legislation doesn't really do anything about that at all.
The chairman says he would encourage supporters of the bill to instead look into information on what state health insurance plans offer for the best coverage.
Unfortunately, whether it's cancer or any other chronic dreaded disease that you're going to come with, you know you're going to have significant expenditures on an annual basis. You're going to start purchasing the type of insurance that best suits you. That's the kind of things that we really ought to be doing.
Supporters say they just want the bill to be given a chance.
So can you confidently say this bill isn't going to get a hearing?
Well, that's probably going to be the result.
It justifies at least getting a hearing. I don't know if it even gets out of committee, but I think it should at least have a hearing in the committee and see where the committee is on it.
I mean, not to say that it's going to make it out of the House, because it may not make it out of the House, but I think it should at least be open for discussion.
And supporters of that bill tell me that they will continue to push for this legislation in the future if it's not successful this year. For now, though, it's wait and see. Doug, Maggie?
Joe, interesting, though, to see how that's playing out right now in the legislature. Thank you.